Uh, Good evening, everyone. Thank you to about 30 participants that is currently present here for our 5th webinar. A big thank you to Dr. Tho Lye Mun, our speaker for tonight's talk entitled The Future of Treatment in a World with COVID-19. You all can hear me, yeah? Okay, a little bit introduction about Dr. Tho. Dr. Tho reads his medicine early years in Australia and then his internal medicine clinical oncology in UK and got his PhD in molecular oncology from the University of Glasgow and earned many medical accolades overseas. Currently, he is attached to Beacon Hospital, Kuala Lumpur as the Consultant Clinical Oncologist. After training and working overseas for 23 years, Dr. Tho returned to Malaysia, taking up the post of Associate Professor at University of Malaya and then subsequently moved into private practice. His passion and commitment to lung cancer has seen him lead many clinical studies in the field, in particular immunotherapy, and serve in numerous regional and international advisory bodies and committees. He has also pioneered the use of stereotactic radiosurgery and stereotactic body radiotherapy for lung cancer, having undergone further training in Korea and USA. He is the current Vice President of Southeast Asia Radiation Oncology Group. He is the co-founder and Vice President of the current Lung Cancer Network Australasia. So we welcome now Dr. Tho now to give his presentation. Dr. Tho.
Thank you, Siu Hong, and thank you so much for SCAN for inviting me and Boon Lui to speak about COVID. So just to, as a disclaimer, I'm not an infectious diseases person, but I am an oncologist, and we have to deal with, almost every doctor nowadays has to know and deal with potential COVID patients. As mentioned, I practice in Beacon Hospital, but I also do some work in Pantai Hospital. So this is the coronavirus. As you can see, it looks like a crown. The word corona comes from crown. The spike proteins on the surface of the virus are the ones that actually attach to the cells in our body through the ACE receptor, and that allows the virus to gain entry into our body. So it looks very pretty, isn't it? So a very pretty deadly virus. Okay, so coronaviruses actually have a long history in the world, and it's not something new. So I apologize if previous speakers have already gone through this. Just let me know if this is too repetitive. We started off with SARS, and as you know, that affected parts of Asia, China, Singapore, but it didn't really make its way to Malaysia, and it was a zoonotic transmission, i.e. that means it went from bats to civet cats to humans, and it only lasted for maybe 6 months with 774 deaths. Then there was MERS in 2012. It originated in the Middle East, but also made its way to Korea, and the Koreans have experience with MERS. And now we have the novel coronavirus, or a virus that, you know, people debate whether it came from, originated in China, Wuhan, or other parts of the world. And there are few strains now. We know there are at least 3 different types of strains, China having one, Asia having one, and the United States having 3 different types of mutations. So how is COVID transmitted among humans? It is transmitted, the COVID virus, the coronavirus, lives in our respiratory tract mainly. So the nose, the throat, the lungs. And when we cough or sneeze or speak, the virus is within those respiratory droplets, and this can transfer directly to another person or onto a contaminated surface. And when the patient touches the surface and then touches their mouth or eyes or nose, they can then get infected. So studies have shown that just by talking and exhaling, the virus can go about 1.5 meters. If you cough, it's about 2 meters. And if you take a big sneeze, that's even up to 6 meters. But our official KKM distance is to stay apart is 1 meter, which in my opinion is a little bit short, because places like America recommend 6 feet. Some countries like New Zealand, Australia is 2 meters. I think that is safer. So what are the clinical symptoms of COVID? Up to 1/3 have no symptoms. I read in Malaysia Kini today, out of 85% of patients tested in Sabah apparently had no symptoms. But the symptoms maybe are missed up, maybe they are very mild. Our DG of Health says 80% of Malaysians either have no or very mild symptoms. We know that people with no symptoms, or we think at least we know that people who have no symptoms may not transmit the virus as badly as people who have very bad symptoms. So people who have symptoms are more infective. What are the symptoms of COVID? Mostly 80% are lung symptoms. So cough, shortness of breath, etc. Fever is fairly common, about 80%. Headache and just generally feeling unwell is about 50%. Loss of smell, this is an interesting symptom, has been reported up to 50%, half of people report it as an early symptom of COVID. Some people have diarrhea and tummy pains because the virus actually, apart from the respiratory tract, can affect the gut. In some cases, it can cause quite bad heart complications. So weakening of the heart failure, but it's more rare, about 10%. And eye symptoms has also been reported. So this is a normal chest X-ray. In the middle here, as you can see, this is the heart. These are the lungs in black, left and right. The white streaks across, those are the ribs. This is a normal looking lung. This is a chest X-ray of a patient with COVID. And you can see that the lungs are full of white fluffy material, and that is the virus causing inflammation of the lung or pneumonitis. And that's a typical picture of a patient with COVID. If a person has a pneumonia, they don't tend to have changes on both lungs. It tends to be on one or the other, right pneumonia, left pneumonia. But COVID tends to affect both lungs. This again just shows graphically the kind of different types of clinical picture that a patient with COVID can have. So the patients with no symptoms can have no symptoms and then but are contagious for up to 14 days. This is where the 14-day rule comes from, KKM. And then they develop so-called immunity. And then patients with mild symptoms may have start off with no symptoms. Then they have, mild to moderate symptoms, and then they become immune. But the patients with very severe symptoms tend to deteriorate very quickly from the start of having COVID infection. They become very unwell very quickly. And that is the pattern of people who have unfortunately passed away with COVID in Sungai Buloh and other COVID centers. And they rapidly need hospitalization or ICU. Okay, so how can we stop COVID or prevent COVID from spreading? All of you have heard about social distancing. This is a diagram taken from American website where they recommend 1.8 meters distance in between people. So COVID is an RNA virus, and fortunately for us, RNA viruses are not very stable in the environment. And RNA viruses don't like heat. So in very high temperatures or in very humid conditions, they don't survive very well outside of the human body. So what can we do? We can open our windows, make sure there's good ventilation, that the respiratory droplets don't settle on surfaces or get blown away. We should wear masks, and for health workers, we should wear PPE, personal protective equipment. And because it settles on surfaces, so surfaces where people touch a lot or maybe breathe on should be cleaned or decontaminated regularly. For terminal decontamination, so let's say a patient has COVID and they go in the hospital, we use Clorox, simple Clorox, diluted to 1 in 10 for hard surfaces. Remember, virus can also appear in people's stool. So regular toilet hygiene is very important. And PPE, this is mainly for hospitals, they should be got rid of in a very sterile condition and not just thrown simply here and there. So all of us have read in the media, oh, we must flatten the curve, flatten the curve. So what does that actually mean? So flatten the curve does not mean that we have less cases. It just means that the cases that appear don't appear all at once. So that's what flattening the curve means. So this is a curve that is not flattened. So you get, this is over a short period of time, you get a huge rise in cases. The problem with that is the health system cannot cope. They can only cope with this number of cases before it breaks down, before people who could be saved are not able to be saved. Not enough ICU beds, not enough medication. So by social distancing and all the measures we talked about, the number of cases that appear don't appear all at once. They appear in a more graduated manner. That means bit by bit, so that whoever requires treatment can get the necessary treatment. Now, now this, by flattening the curve, you unfortunately prolong the period of time which the country is under lockdown or people have to undergo restrictions, because the number of cases will not appear all at once. So I suppose the bad news for us is after MCO, most likely we will have a surge of cases again, as people who were isolated away but have the virus now go out in the community and start reinfections, and may have to undergo a second round of lockdown. We shall see. So the problem with healthcare resources is they are finite. So on one hand, you have COVID, but on the other hand, you have all these other diseases that require the attention of medical professionals and people that may have been taken away to combat COVID. So cancer, heart diseases, diabetes, we hear a lot of stories about people whose diabetic control has gone out of sync, and because they cannot visit their endocrinologist and get the medications. We know there's a resurgence of dengue during this time because a lot of houses, a lot of properties are left unattended to, and dengue is on the rise again. And delivery of medication to patients, especially who live very far away from their centers, is now beginning to be a problem. Although KKM has done a very good job in being able to deliver medications to many patients. So in terms of cancer care, as you know, we have the lockdown, meaning people can only travel for very legitimate reasons, but this may have an impact on cancer patients. We know from a study published in 2019, the average distance a patient needs to travel to go to a cancer center with radiotherapy is 83 kilometers. That's a long distance. Where I practice in central KL, in the central district, is only 14 km. But in the northern region is 43, southern region 36. East coast of Malaysia, it is 124. And where my good friends come from today, East Malaysia, is 228 kilometers. My friends in Sabah tell me they hear of patients having to take a bus overnight, walk out of their village, take a bus, just to attend a clinic follow-up, and that's really made worse by the current MCO. So if you don't flatten the curve, you end up like the UK, where Prime Minister Boris Johnson got COVID and had to be admitted to ICU. And luckily, he is making a recovery. The UK also has a severe shortage of PPE, and their death rate is probably higher than what it should be in the world. This is when because the UK government took a decision not to lock down. In fact, they were advised wrongly that COVID is probably more like a common flu, that people will get it and survive, that they don't need to lock down the country. Dr. George Gao from the Center for Disease Control, the head unit that looks at infections in China, was asked, what is the biggest mistake countries are making? His answer was, the biggest mistake the US and Europe is making is that people aren't wearing masks. So these are the various types of masks that are out there. As you know, the US also had a no mask policy, but they recently changed their view and said people going out of the house should at least have a cloth mask, so which is the one on the left, homemade DIY cloth mask. The next grade up is a surgical mask, and that's the mask that you can buy at pharmacies. And then a little bit harder to get are N95 respirator masks, and those offer the even higher level of protection. But the value of the mask is not predominantly in preventing you from getting an infection. It's preventing the infected person from infecting another person. So outward protection. So I protect you, you protect me. So as you can see here, a simple cloth mask maybe can only prevent 10 out of 100 particles from getting through. Surgical mask maybe can absorb 50% of the particles, whereas N95 can absorb 70% of the particles from getting through. And of course, wearing a mask does protect somewhat yourself from receiving those infected droplets from the environment, but the main value of a mask is protecting other people. And if everyone is wearing a mask, and that reduces the amount of infection particles in the environment. So how do you wear a mask? It may be very simple, but actually there's a little bit of skill to it. You need to wash your hands, make sure their ones are clean before you put on the mask. If you're wearing a surgical mask, the blue side is on the out, the white side is on the in. Do not touch the middle of the mask. Step 1, touch the outside of the mask, put it over your neck, then adjust the nose, then adjust the width so that it covers from the nose down to the chin. Press on the metal bit over the nose, and there you go. But do not touch the middle of the mask. When you take it out, similarly, be very careful. The dirty part will be the white part. So you take it out from the ears. Do not touch the middle of the mask. I think we've also heard about herd immunity and vaccination. So what is all this? What is this concept about herd immunity? So if you look on the far left, you can see that the infected people in pink, if they go into a village or city or town or community or Starbucks or the kopitiam, there are people who, there are many white dots around, people who have never been infected, who are healthy, who potentially can get the virus. So the ones that are vaccinated or have had an infection in the past and are now immune are blue. So in the situation where there are many people who are vaccinated or have been infected before, it doesn't necessarily mean okay, I hear quite a lot of background noise. If I can perhaps kindly request maybe mute. Thank you. You can see that you don't need everyone to be vaccinated. You just need a good number of people to be vaccinated, and the white dots are very far away from the yellow dots. So that's what herd immunity means. It means most of the people can't transmit the virus, and that protects the people who are still susceptible to the virus. As you know, as has been reported in the papers, there are 70 coronaviruses vaccines now undergoing trials. At least 3 have made it into human vaccinations. So this may be a promising approach. However, the bad news is that reports from places like South Korea show that even people who have been infected by the virus in the past can still develop COVID a second time round. And that maybe suggests, and we don't know for sure yet, we're still learning a lot about the virus, that vaccinations may or may not be possible. We still have to watch this space, as they say. How do you diagnose COVID? So there are 2 main ways. One is to take a swab of the nose. You can see it's not the most comfortable procedure. The swab is quite long. It goes not just in the nostril, but right at the back of the nose. That's the nasopharynx, and that's where the virus tends to live. We also swab the back of the throat beyond the tonsil area. This goes into a sealed container, and then we do PCR on it. Another way is by a pinprick, and those of you who do this regularly are probably diabetics who need to check your glucose levels regularly. So it's the same process. You do a pinprick, and then a drop of blood is put in a COVID test kit like this, and that tests whether you have antibodies towards the COVID. We just heard today that the DG of Health has announced that this test, this antibody test, is probably going to be necessary to be performed on anybody wanting to go back to work during the MCO. So you must have a pinprick, negative, wait 1 week, pinprick again, test your blood, and if you're negative, only then you get a certificate to be able to go back to work. I stay in PJ, stay and work in PJ, and PJ is one of the highest hotspots in Semenanjung, Malaysia. And my friends from Kuching, unfortunately, they know that Kuching is probably the biggest hotspot in East Malaysia. How are we doing compared with our neighbors, Singapore and so forth? So there are 3 things that probably we need to look at, not just the number of cases, but we need to look. I don't think the number of cases gives you an accurate picture of what the situation is like. We need to know the number of cases per million population. So for every 1 million, how many cases do we find? So we see that Singapore is 10 times higher than us, 1,700 per million population, Malaysia 171. But you could say, wow, Philippines and Indonesia are doing well, only 61 and 27 per million population. But look at the number of tests done. Singapore does a lot more tests than us, 16,000 per million population. And Malaysia only does 3,000. So the more tests you do, of course, the more COVID you will pick up. Unfortunately, places like Philippines, Indonesia are, they have financial limitations, resource limitations, and I'm sure their numbers are much higher, if not higher than Malaysia. How do we do? How are we doing compared to the Western world? I have to say the situation doesn't look good in the USA and in UK. USA does 12,000 tests per million population and has 2,000 plus cases per million population. And the death rate is not good, it's 137. UK, the death rate is 255. So I think UK probably has a lot more cases than they are able to test for. In fact, my friends who are still working in UK as doctors know that they are very, very short on test kits. And sometimes doctors who have been exposed to COVID patients are even forced to continue working because they are so short-staffed. I think Australia is doing extremely well. So Australia, New Zealand, they test a lot of cases. They have extremely low death rate an extremely low number of COVID cases. I mean, we don't know why. Probably Australia, they already have social distancing without lockdown. You know, there's such a big distance. Their population is quite sparse, and also they are, you know, around this time they are in the middle of Australian summer, which can be 40, 45 degrees outside. So where our next wave of COVID cases coming? Malaysia anticipated that a lot of returnees from abroad may bring COVID. You know, in Singapore, 10% of returnees from the UK had COVID. So I think the DG of Health is doing an excellent job. He decided that all returnees need to undergo quarantine, which has been enforced, and I think that has really saved Malaysia from this returnee outbreak. However, the elephant in the room is the foreign workers in Malaysia. So Singapore has had a tremendous spike in cases for foreign workers, 1,000 over cases per day for the last few days. They now have more than 10,000 cases in a small country of 6 million people. And these were 90% or more of them were foreign workers. But the good thing about Singapore is their foreign workers, the 200,000 foreign workers they have, all live in dormitories, all accounted for, they know where they are, they know who their contacts are. Unfortunately, in Malaysia, we have a different situation, and this potentially could be the next surge in the Malaysian COVID wave. So we now shift gear a little bit and talk about COVID and cancer. And these are the stories that are emerging in the newspapers. He did not deserve to die like he did. So the cancer patient died alone. No one was allowed to visit him because his COVID test was not back. And we hear about surgeries being canceled, treatment being canceled, patients having to wait because the doctors are not admitting any more patients due to the COVID scare. So do cancer patients have a higher risk of COVID? The answer is yes. So we know that out of Wuhan, for example, cancer patients had a 2.3 times more higher chance than just ordinary people of catching COVID. Out of this, about 60% were lung cancer patients. In Guangzhou, similar situation, the risk of COVID in the cancer population is 3.5 times higher than the normal population. Again, many of these patients were lung cancer patients, and we know that lung cancer is also a risk because of the weakened immune system, not only that, the weakened lung capacity. And if a cancer patient catches COVID, what is the risk of death? It turns out that the WHO and the China Joint Mission on COVID looked at this issue, and the risk of risk of death from COVID if you're a cancer patient is 7.6%, but versus a normal population, 1.4%. So that's 5 times higher than the normal population. The Italians also showed that out of their first 355 cases who passed away, 20% were cancer patients. But not just cancer, other conditions also increase the risk of getting COVID and bad COVID. So high blood pressure, diabetes, elderly population, smoking is a risk factor for COVID, heart disease, and also lung disease. So given all that, what have we done in Beacon to protect our patients, make sure our patients do not catch COVID, and our staff and all visitors are also protected? So we follow Garis Panduan COVID EDC 5 as rolled out by the KKM. We have a COVID screening station before you even enter the hospital. If you have any of these respiratory symptoms with or without fever, and you have travel, close contact COVID or cluster outbreak, you cannot even step into the hospital. We will see you outside the hospital, do our testing, bring you back a few days later only if you test negative, or if you test, or we may even need to contact KKM to send you to a KKM hospital. What does close contact mean? Close contact, according to the KKM, is 1 meter distance for 15 minutes or more, or in the same household, or doing things in a confined space, confined environment. How does that affect our treatment? So for me, when I see my patients that require radiation to the lung especially, so I'm extra careful about making sure we check for COVID before we start. So there's no point treating a patient and making them immune compromised, immune system goes down, and then they catch, and then the COVID takes over their system. So it's my practice to really make sure all my patients are free from COVID for their health before they start any of these high-risk treatments. High-risk treatments also include chemotherapy. In terms of immunotherapy, there's no real evidence or to show that immunotherapy is dangerous together with COVID patients. But again, we must be very, very careful. What's happening in, so I practice in Beacon, which is a private center. So we have the luxury to continue our normal services, albeit with much more vigilant testing and precautions. However, in the government centers that treat cancer, quite a number of them have had to scale down their activity. And as a consequence, cancer patients may have to wait longer periods of time in order to get seen. So some centers have stopped taking external referrals. They only take internal referrals. The volume of cancer surgery has also reduced, so people are having to wait longer for their surgery. In terms of training of the residents or the MOs, oncology MOs, the exams have all been postponed, classes have been postponed, and intake has also reduced. In some cases, the MOs and even the consultants are being rotated to COVID wards, fever clinics, swabbing, and testing. So the other essential practices in Beacon are social distancing. People must sit at least 1 meter, if not 2 meters apart. The staff are discouraged to wear ties and lanyards and wristwatches because any bugs or germs can live in this and you don't wash them every day. Phones are also a so-called danger where all your spit and saliva goes into the receiver, and those must be clean as well. Okay, so what are the other consequences of COVID on our society, especially with the lockdown? So a lot of economic activity has stopped, and a lot of people are getting more and more anxious about bills, about their business and tax that they need to pay, and bankruptcy issues. Staying at home with the so-called young children who are, want your attention, but sometimes maybe are too vigorous in their crying, is causing a lot of stress on a lot of people. And our elderly relatives, are they getting the help they need? On one hand, we are discouraged from visiting our elderly relatives because they are the ones who are most vulnerable for COVID. We may be asymptomatic, we don't have symptoms, but when we visit them, we pass the virus to them. But at this time, there's a lot of loneliness. There's a lot of people who do not get the help they need. Some people are even talking about COVID going through this MCO and all these restrictions like a post-traumatic stress syndrome. So when people come back from war, they are still troubled deeply by their experiences, even though they've returned to normal society. And this may happen even though MCO is lifted. But what are the opportunities? And this is a slide that I worked on with Dr. Ken Fong, who's very kindly given me very, very good ideas. He's a friend and consultant ophthalmologist. Well, a lot of us are finding that we can learn to live and be happy with less. There's no need to go out and have fancy dinners every night. Whatever we have, we conserve and be satisfied and be happy with less. There's a little bit more time, from our hectic schedules to be with family and friends, even though on Zoom. Time to update your skills, hobbies, and stay fit and healthy. Sometimes this stressful situation also tells us gives us assurance that who are our real good friends and relatives are, who will call us, encourage us, give us the strength to carry on. And who knows, in the long term, we may even change our lifestyle and have less long haul travels or holiday. We may be more cuti Malaysia. We must, and a lot of us thinking about more sustainable way of living, recycling, and being able to live on less. Things are moving online. So I think this change will stay even though COVID has passed. And we probably will need extra infection controls for many years to come. I don't think things will ever go back to normal. And of course, listen to your experts. And in our community, you know, we must remember people who have less than us, who are struggling in this time. Even the animals are struggling. And I've been feeding dogs outside my hospital because, you know, otherwise they will have no food. So how can you help as part of a caring community? You can donate to certain funds, seek out certain groups that are doing good. From your part, don't spread wrong information on social media. If you're not sure, don't share it, don't forward it. Stay calm, stay focused, stay caring, and lead your home and lead your workplace. So that's all I have to say. And I think I'll pass it back to the MC.
Thank you, Dr. Tho. A very useful and informative presentation. So we can open now for a question. There's actually two ways. One way is you can go to participant and then find your name, and then you can actually click on the raise hand, and then Chris will unmute you, and then you can ask question. Okay, the other way is you type your question in the chat and Dr. Tho can answer that too. So, okay. So let's go to the chat. Yeah, Dr. Tho, all yours.
Okay, so so from Chris Chang, what do you think the government should do to prevent the surge after MCO is removed? I think the government is already looking into testing foreign workers. For example, the Selayang market, where a lot of Rohingya refugees do business and live around that area. So I think they're already trying to test for COVID. I think it depends on what happens, but I really doubt that they will lift restrictions on mass gatherings, for example. You know, and I think social distancing will be with us for a long time to come. Okay, Dr. Tho, what factors are considered when a cancer treatment is defined to be high risk? So high risk cancer treatments are treatments which actually lower your white cell counts. The white cells in your body help to fight infection, and there are many different types of white cells. There are neutrophils, there are lymphocytes. The one that we particularly worry about are lymphocytes, and things like chemotherapy, radiotherapy to parts of the bone. The bone marrow produces the white cells we need in our body. Radiotherapy to this area can also cause a lowering of the white cell count. So cancer patients going through treatment need to practice very safe social distancing, need to wear a mask at all times, be very mindful of their personal hygiene and the hygiene of the food they take in and the contacts they have. I'm hearing quite a lot of echo. Is that from me or? So sorry. Okay, so Dr. Tho, have you acquired any new hobbies or skills during lockdown? I'm still working actually, so I suppose I'm one of the rarer people who still continue a full 9 to 5 job during the MCO. So unfortunately not. With the previous Ebola virus outbreak and now COVID, do you foresee the obligation to take extra precaution on drug prescriptions as a measure to reduce chances for emergence of superviruses? So Ebola and COVID are not like bacteria which emerge from multi-drug resistant situations. So they have just arisen out of nowhere. So nobody knows where the origin of COVID is, but it's certainly not it's not because because doctors have prescribed too much antibiotics and there are resistant organisms in the community. That applies to bacteria, not viruses. So, I mean, we don't know where COVID came from. People are under assumption it came from bats and it jumped across to human beings. But of course, there are many conspiracy theories out there. I think all of us may be familiar with one or two of them, the Wuhan lab and so forth. But hope this is not being recorded. Dr. Tho, what's your recommendation on survivors taking pneumococcal vaccination? So I think you can proceed with your normal vaccination schedule. Of course, if you are immune compromised, either from undergoing chemotherapy, then your oncologist needs to advise you probably it's not the right time to get vaccinated. But if you're not undergoing treatment and you have an intact immune system, then your vaccination should probably go on as per normal. Do we know why our government does not implement 2 meters social distance? I'm not quite sure, so I don't know. It seems a bit arbitrary. Some countries will be 1, some countries will be 2. The Americans don't work in metric systems, so they go by 6 feet, which is 1.83 meters. So a bit arbitrary. Cancer patients who are post-chemotherapy a year, are their immune system considered weak? Yeah, so this is a very good question. I think having cancer in itself causes the immune system to be weak to some extent. And in my patients who've had chemotherapy or major chemotherapy or major radiotherapy, sometimes I see that their lymphocyte counts do not recover for even up to a year. So I think if you've had cancer treatment within the last 6 months, certainly, if not even a year, potentially your immune system may not be as strong as a normal person. How do we continue to be on our toes for the rest of the year, trying to be prepared, not fearful, inspired, not inflamed? I don't know, I probably have to learn a lot from you. I suppose I'm the same as anyone else, prone to sometimes fearful situations, inspire and not inflame. I think the way to do it is to think of others. I think that's probably the simple answer. If you focus on something outside of yourself, helping others on what is good, and those of you who believe in God, focus that and believe in God that He's in control, and I think that's probably the way. Sorry. So nobody knows when this will end, unfortunately. Maybe 6 months, it may be 1 year, 2 years, 3 years. But I think it's something which, well, not to think too far ahead. You just take it a day at a time. What advice do you have for cancer patients, especially lung cancer patients, for the treatment consultations are now affected? Okay, So in some of my patients, I've been postponing their return visit if it's not urgent. So instead of doing a scan at 3 months, for example, maybe it can be done at 4 months or 5 months. So that's one way, but these scans eventually will need to be done. So sometimes it may not. It's in fact, my hospital Beacon, we are now limiting the number of scans we do a day. So actually, now is the best time to do a scan because we have we only accept a certain number of patients, so there's more social distancing, there's more cleaning involved. So it's a difficult one. So I definitely know that places like the UK, they've been postponing regular visits. That's because the hospital cannot cope. So that's a different situation. Yeah. So cancer survivors, immune system weak. I think I've answered that one. Dettol diluted will be good as Clorox. I don't think Dettol may be as good, to be honest. So there's a KKM recommendation for the what type of material, what type of chemical you can use to detoxify. I have a history of asthma. I read some news that those with flu vaccine lighten the symptoms. Is this clinically proven? I have bronchial asthma. I read from some news that those with flu vaccine lighten the symptoms. I'm not sure what that refers to, but there was some reports that people who've had previous BCG vaccination may be protected from COVID, but this is not proven. This is just a general observation that places like India, where there is mass BCG vaccination, they feel the COVID incidence is not as high. There are certainly trials going on in places like Australia, where they're actually giving BCG vaccinations for TB, tuberculosis, to healthcare workers in order to test whether BCG can protect these healthcare workers from getting COVID. Do you see a high risk in advanced GI cancer patients? Yes, I think all cancer patients potentially have a weakened immune system and are more susceptible to COVID. Good question. Do you think cancer research has been impacted by COVID in terms of resources? Definitely it has. So a lot of trials have reduced recruitment, and a lot of drug companies who fund these trials have been affected quite severely in terms of economy-wise. So the funding for research has also been reduced. So whether this is a temporary situation or whether it will, be a more sustained problem is yet to be seen. But of course, cancer research, as you know, is very important. It's the way we test new medications, make sure that there are new drugs to combat cancer all the time. So again, it's something that we need to watch this space. So I've done a lot of talking. So maybe rather than reading questions, anybody want to ask me anything and give me a chance to take a breath?
I'll help you read it out. I think the next one is, how do my friend on chemo improve her WBC consistently?
Okay, so in terms of the white cell count during chemotherapy, there are a few ways. One, in my practice, I want to make sure that the white cell count does not even have a chance to drop. Okay, so sometimes you only wait till they drop and then institute some treatment for it. For me, I'm very, very particular that in my patients, the white cell count does not drop, or if it drops, doesn't drop too low. So you can use GCSF injection into the tummy area. It's a small needle in between chemotherapy cycles to bring up the white cell count, or especially the neutrophils, to make sure they don't drop. The other way is you need to have good nutrition in order for your body to build up all these cells. And so it's important to get good protein levels in your diet. I think there's nothing wrong with being a vegetarian, but some of my patients, when they know they have a diagnosis of cancer, they decide to become vegetarian overnight, and their body is not used to it, and they don't get enough protein. So if you're vegetarian, you need to eat enough beans and tofu and so forth to make sure the protein levels are high.
Okay, I can read from Chris, right? From Chris to everyone and to Dr. Tho. Beacon Hospital has several CSR fund for cancer patients, from chemo fund to targeted therapy for breast cancer patients. Will this be increased to help more cancer patients, especially those affected by loss of job or income?
Yeah, I think it's a good question. I mean, I work in Beacon, I don't own it, so, but I can definitely put this question to the owners of Beacon and ask if they can make some kind of provision. It's bad. I think MCO has only been a month and a half, but probably we can hear stories of people who are already quite affected. And especially there are some government centers which have stopped taking patients, for example, UM and HKL. So these patients are trying to find ways to get the treatment. I don't have an answer for. Yeah, I don't have a simple answer for that.
Okay, Dr. Tho, Grace here.
Hi.
Hi. I just wonder, so if a person has COVID, and it could be asymptomatic or it could be full-blown, and you sort of get tested, you get treated, you recover, do you develop antibodies after that? Like some illnesses, we know that if we're exposed to certain virus, you develop antibodies. Because now they're saying, like in Korea, they see people who get the COVID again after testing negative. So doesn't that really mean that, you don't really develop antibodies?
Yeah, so most of the studies that have been done show you do develop antibodies. So that means your body makes some kind of signal. It produces all these IgGs or IgMs. These are antibodies that are meant to target the COVID virus, and they remain in your body. So they're there. But we don't have evidence that these antibodies are 100% protective. So that means even though you have the ability to make these antibodies to fight the COVID, but if you get infected again, we don't know for sure that these antibodies can protect you fully against COVID a second time.
Does that also mean that if you nobody knows whether you can get infected a second time, but does that
like
also but does that also mean that that person is again a potential carrier, and you can infect somebody again?
Yes.
Oh, that's so sad.
But we
Okay,
don't have we don't fully understand the virus. That means we don't know out of 100 people who develop the antibodies, how many can be reinfected. We don't, that information nobody knows at this present time.
So we're basically saying that even after MCO, if it gets lifted, it still might not be safe to go out.
I mean, it might be safer, but it's not 100% that at this moment, as far as we know, that you may not get COVID again.
All right.
So
Two more
everybody talks
questions.
about, So everybody talks about the new normal. And I think it's true. I think after COVID, we will have a new normal. What that normal is, no one really knows, because every day we're learning something about the virus and how it affects the human body.
All right, another two more questions. The next one is, okay, we hear a lot of questions from cancer survivor 1 year after chemo, 2 years after chemo, and their immune system. What about cancer survivors for, let's say, 10 years? Would you say that they would still be in the same boat as those that have just completed chemo, or are we slightly better off?
I think 10 years, probably not. I think after maybe about 1-2 years, I think your body starts to normalize.
All right. And then last question, sorry. So I have been in a dilemma for quite a while now because I have a son in London. And while all his friends have left uni to come home because now final exam will be online, I have asked him to stay put. And now looking at your figures, UK is worst off. So now my question is, should we get him home or should we let him stay? Because it seems that we are doing much better here. And they have no mask there.
Yeah, they don't believe in masks, unfortunately.
But I sent a mask a month ago. It has not arrived, unfortunately. But what I'm trying to say now is a lot of students are coming home. I was trying to be like, no, you shouldn't come home and bring anything back. If you do bring anything back, we don't want to have imported cases. Now I'm thinking, is it safer for the student to stay back, or should we get them home? Because now it looks like we are better off here, I mean, medical-wise.
I would say, I would feel safer in Malaysia, for example. I think those of you who may have come to Beacon recently can see that every patient, visitor, doctor has to wear a mask. That's our rule. And I think, even in the community now outside, in KL at least, I don't know what it's like in Sarawak, Kuching, but I think people generally, by and large, are very respectful and follow the MCO and social distancing and their temperature checks at when you go and buy your supermarket groceries and things like that. Personally, I would feel safer in Malaysia. Whether to bring him back or not, it's a very personal decision. Obviously, there are many considerations, not just safety, his education, his...
Another question, sorry.
Yeah, his education. And of course, if you come back, the government has a 14-day quarantine rule, and that must be respected. Yes.
Definitely. Sorry, just one last question. I was figuring out, like Singapore, they're foreign workers. They're finding a lot of cases among the foreign workers in the dormitories. And just now you mentioned about like foreign workers in Malaysia, we worried about them because of contact tracing. Now, I'm just wondering, these foreign workers have probably been in the country for a while now because they've been working there. But how do they get it? Because of, why do we see the spike in foreign workers? Because, obviously these workers must have been in the country for quite a while. It's not like they just traveled in, So how do we explain the spike in the foreign workers? Okay, is it because of cramped condition? The virus just love condition like that, or any other reason?
So no one knows where actually the foreign worker cluster outbreak started in Singapore. They think they found quite a number of cases linked to this shopping center called Mustafa Shopping Center, which a lot of foreign workers go there to buy their groceries and do shopping. So, but where Mustafa, where the person at Mustafa Center got the virus, nobody knows. The problem with for not just foreign workers in Singapore, foreign workers anywhere in the world, or people not even foreign workers, people living in cramped conditions, is that the virus spreads very, very quickly. You know, person-to-person contact where there's not much hygiene, or surfaces are not decontaminated, the virus spreads quickly, and you expect that. I mean, not just foreign worker situation in Singapore. Right now in Malaysia, it's good because everybody, everyone, including the foreign workers, even though they're living in cramped conditions, they're not going out and mixing in the population. They're not mixing with each other. They're not going to work. They're just staying put. So even if person A has the virus, but if person A goes out, he can pass the virus to 100 people. But if person A stays at home and after 14 days, his body clears the virus, person A is not infective anymore. So that's where the lockdown, that's where the MCO comes into place. So even people who are infective, they are not contact traced, who have the virus, it dies off. Not the person dies off, the virus dies off. The body clears the virus. And the virus cannot find another person to jump to carry on.
Thank you, Dr. Tho.
Okay, looks like it has been a while. So there's a couple more questions. Dr. Tho, do you still want to continue, or we leave? We let it be, and then maybe somehow, if needed, we'll send to you.
I can do 2 questions more.
Okay, 2 questions more then.
Do you want to choose the questions?
Yeah, you go ahead and choose, Dr. Tho.
Me?
You took my question.
Okay, vitamin C. Does vitamin C help COVID? Answer is we don't know. So treatments for COVID. There are some studies that are done in patients in ICU. That means they are under, they've already had, not COVID patients, but just general patients with infections who needed to go to ICU and needed a breathing tube to help them breathe. Otherwise, they would not make it. So in these patients, they did give very high doses of vitamin C as an antioxidant to reduce inflammation. And they found that those patients actually did better than the patients who did not get the high dose IV vitamin C. High dose IV vitamin C is not used a lot in Malaysia, I have to say that. But if you're asking me whether just taking tablet vitamin C 1 gram a day helps to fight off COVID or getting you COVID infection, then the answer is nobody knows. But we know that if you over-vitamize for a long period of time, that's also not good for your kidneys, for example, because most of the vitamin C you consume comes out in your urine, and that's making your kidney work very hard every day. So if you were to take high-dose vitamin C, possibly a wise way to do it is not every day, maybe just 3 times a week, 4 times a week, something like that. We know that there's a report that came out from the US today that said hydroxychloroquine, the drug for malaria, may not work as well. But previous reports from France, there was one from France, there's one from China, showed hydroxychloroquine worked. Certainly in Malaysia, in KKM setting, they continue to use hydroxychloroquine for early COVID cases to prevent them from deteriorating. So there's still a lot to learn, you know, there's still a lot of experiences that need to be shared. It's a moving field, every day is different. Okay.
One last question.
One last question.
From
okay, something about China. Shall I answer that?
China.
To get arrested.
This is actually being recorded, so.
Okay, skip.
This one I think is a good one. High risk to work with colleagues or customers who have recovered from COVID. How to protect ourselves, especially as a cancer patient? Should we stop work temporarily?
Okay, I think I mean, if you work in an environment where there's a lot of close contact with customers, colleagues, even after the MCO is lifted, I think you should still practice social distancing. I don't think this COVID thing, in my personal opinion, this COVID thing will not go away for at least a year. We will be having clusters, outbreaks from time to time for at least a year. So for my patients, I would definitely advise them to practice social distancing for a year. I mean, it's difficult because sometimes your work, you have to meet people, but maybe you can be creative or find different ways to do that conference or to do that brainstorming session using Zoom, or people worry that Zoom may be the what do you call, the security not so good, or Cisco WebEx, or whatever platform you feel secure with. I think most people will be moving online nowadays, even sales and so forth. From our side, we are exploring teleconferencing for patients, so they don't have to travel, they don't have to wait in crowded waiting rooms. But of course, a lot of legal considerations have to be worked out before we can roll things out. And I think over the next few weeks, most companies are thinking of moving things online in order to survive. But also it's good for our protecting our health.
Can I ask the last question?
This is the very last, Grace. No more. Yeah, sorry.
Okay.
The very, very last.
So we were talking about the flu vaccine. Okay, I know that the flu vaccine does not protect a person from the COVID-19, but by having the flu vaccine, it does reduce our chance of getting influenza A and certain strain of the coronavirus that causes, the flu during the flu season. So by having the vaccine and cutting the risk of getting all this influenza and flu, does it also mean that you would have a lesser chance if you don't fall sick in the first place? You might not be so susceptible. I know it's a bit far-fetched question.
In terms of COVID susceptibility, I personally think it's not going to be too protective. Yeah. Because if you do get exposed to a person with COVID, most likely, like without masks, without PPE, and you do get infected with COVID, there's a high chance you get infected with COVID. Yeah.
Thank you so much, Dr. Tho, for your time.
Okay, very good. Thanks, Grace. Okay, Dr. Tho, I think, great talk, and I think there are just so many questions for you, and you have answered so well. So thank you very much. Thank you to all the participants.
Yeah, thank you, Dr. Tho.
Your question not answered will somehow, if you're still in desperate need, you can still come back to us via Facebook. Okay, thank you, Dr. Tho. Anything, Bung Lui? Yeah, go ahead.
Yeah, perhaps we can compile some of the questions, key questions. We let Dr. Tho answer, and then we can post it on our Facebook later on.
Okay. Yeah, sure. Thank you, everybody.
Yeah, thank you so much, Scan, for very, very kind invitation. And you're doing the hard work, the cancer patients, survivors are doing the hard work.
Thank you, Dr. Tho.
Thank you by full support.
Thank you, everyone. Good night.
Thank you, Dr. Tho.
Good night.
Good night, everybody.
Bye-bye.